Hi, this is Dr. Lokesh. I'm going to present in this discussion about government proposed next examination. It is time tested. Actually, national examination is tested almost 100 years in USA. And the same examination is used for licensing and also PG selections. And the multiple choice exam, it has been used since 1954. Let me go through the information. So government proposed, like Indian government proposed the next examination. They bought NMC Gazette, and it specifically says one examination should not only give a license, but also do the PG selection. Is it anywhere in the world? Yes, 70 years in USA it's been doing, and we'll go through the information. National examination for medical licensing, it started 100 years ago. NBME, William Rodman, he's the one who founded in 1915. He's a actually distinguished professor, and he started his work in 1890s, but it took him 20 years to form the 1915. By 1943, almost 28 years later, all the states, 50 states in the United States, had joined and accepted this examination certification. But unfortunately, he never got to see his first test, which is implemented in 1960. He suddenly passed away in 1916, just months before the first exam were given. So history in the late 1890s, Dr. Rodman is a well-distinguished surgeon from University of Kentucky, take a job in Philadelphia. So he has to face two things. One is he has to face another exam. So he has to imagine taking another exam from one state to other, being a senior professor. And also that exam is not good, awful exam. So his experience, this experience shaped him. He took the shape the rest of his life. Almost 2 decades he worked. He spearheaded an effort to create a national exam for doctors, a test of such rigor, quality that individual states would gladly accept a passing score in places of their own examination. Unfortunately for him, this wasn't exactly era of broad collaboration. Same thing in India also. We have different states, we have different policy makers. So we have in USA, 10th Amendment in their constitution says states to manage their own affairs, especially health. Even India, states have own affairs. And it's pretty powerful political dynamic back in 1915, same as now. So a federal examination is definitely not states will accept. That's what they have to face. And the states, each state feel that is intrusion in the states and rights and state autonomy. So the idea get early backing from United States military. Who first came in? United States military doctors said, "Hey, we want to take this for examination." In World War I, they want to keep their standards are very high. Then that is how the process started. That's early history. USA 1915 NBME started as we mentioned, and the first exam is established 1960. Remember, these exams are same. It started like essays, oral questions, bedside examinations skills, the same exam like we have in 2024 in India. And so this is the examination paper. Anatomy have 3 hours, chemistry and physics is 3 hours, physiology, pathology 4 hours, and bacteriology 2 hours, such as same examination, clinical lab, laboratory, etc. But in 1954, after 20, they changed it to the 1954, almost 40 years later, they changed 100% MCQ pattern. That's what our Indian government requesting put the next examination 100% computerized MCQ with high competency, high order tested. In 1924, NBME of USA unveiled a new test based entirely on multiple choice questions. These new MCQ-based NBME Part 1, Part 2 exams reported scores as two-digit number, and just as an original exam, applicants need a score 75 to pass. And also give a number so that way it also selects the PG seats, postgraduate seats on the basis of high scores. 70 years since start of multiple choice US examination USA, but they have not started 15%, 20%. They are 100% tested. There is a lot of scientific evidence to do that. 10 states in USA left NBME because they don't like the new examination, but all joined back NBME examination. But MBA never went back on their format of exam of multiple choice. Even though 1950s MCQs format came and dozen states opted out, a new type of test question was coming in. They did a lot of work. Simpler, more black and white way of measuring knowledge, a multiple choice. After much consideration, they did a lot of work. NBME faced this new format into exam. It did not go over well. Not only did NBME hear a pushback, a large number of states, approximately 10 states, they pulled out of the exam. But of course, they all came back. For the next 20, 40 years, the format remained consistent with three multiple choice exams during all 4 years medical and residency training. I requested in my previous video, the pass rate of MBBS, almost 90% should be NMC pass rate too. And if there is a history now, I came to know 2 days later of my presentation. So they faced with, and under the world essay oral exam, there's 86%. So NBME part 1 started with multiple choice. They went with 86% pass rate. So I'm requesting NMC give same percentage as past 5 years MBBS pass rate, especially part two of final MBBS. And you have this article here explaining the information in 1950s in NBME in USA. So they faced it again in 1990s. The NBME has faced another under legislative threat. Both foreigner doctors, United States doctors, and new competency based. They have to say who is the minimum standard and what are the scores to be given to select the postgraduates. So they went to the criterion reference model, and also they looked at Angoff method. Angoff method is experts will decide what percentage student pass. But NBME went another step, but they took a survey of licensing boards, like each state's medical student, faculty, even the public. Then they came to the conclusion, and they kept the pass rate same. So the pass rate, new and old exam is same. So that's what we request. This is very important procedure they followed, and NMC should follow. Therefore, if you are NBA, instead of just asking content experts, unbiased criterion reference standard, you create multi-input process. So that's what the survey, that's what NMC need to take a survey of all the universities to get the correct numbers. Such a process, NBM is smoothly assured to stakeholders that a major shift pass-fail rate is considered unlikely with the new test change. And they published in 1990 NBME exam newsletters. In last letter, again, the pass rate, and thus it come past the passing rates for the new criterion reference comprehensions and NBM part 1 exam were essentially identical. So my request is the submission to the student, faculty, and NMC, government, medical associations. Please look at this evidence, and I'm sure you will come to the right full decision. This will help not only just passing exam, the quality will be going improved, and it eventually it's a public health. We're going to be keep highest standard in the world. Thank you.